Hello everyone, welcome to another session of E-Path to Success. My name is Dr. Mahesh and I'm working in the Department of Oral Pathology, KMCT Dental College, Kozhikode. Today's topic shall be on pulp. The learning objectives, first we shall discuss about the general features of the pulp, the functions of the pulp, the histology and the zones of the pulp, and the age changes in the pulp. So here you can see the strategic location of the pulp. The pulp is located inside the tooth and is surrounded by dentine. If you look at the general features of the pulp occupies the center of the tooth. It is soft and it is an ectomesenchymal connective tissue and is surrounded by dentine on all sides. And we usually call it as the dentine pulp complex, closely related. So we usually call it as a dentine pulp complex. The pulp is divided into two parts. One is the coronal pulp, which is seen in the crown portion, and the radicular pulp, which is seen in the root portion. The coronal pulp, its shape resembles the crown. It has 6 surfaces: occlusal, mesial, distal, buccal, lingual, and the floor. And the extensions into these cusps are called as pulp horn. And the number of horns is equal to the number of cusps. When you come to the radicular pulp is the pulp that's seen in the root portion. It extends from the cervical region of the crown to the root apex, and it is continuous with the periapical tissues through the apical foramen. Now, what about the apical foramen? The average size is around maxillary teeth is around 0.4 mm, whereas in mandibular teeth is around 0.3 mm. The location and the shape of the apical foramen may change due to the function influences, and the relocation of the apical foramen is seen in the tip and the teeth showing mesial migration. And you also have the accessory canals. The accessory canals are seen on the lateral sides of the radicular pulp, and the reason is the premature loss. It could be in areas where there's a premature loss of the root sheath cells, and the accessory canals may also occur where the developing root encounters a blood vessel. So in this picture now we can see the location of the pulp, which is located in the pulp chamber, and you can see it's surrounded by dentine. You can see the accessory canals or the lateral canals of the side. When we discuss about the deciduous or the primary pulp organ, it functions for a shorter period. The average age is around 8.3 and the pulp aging is faster. Whereas in the permanent pulp organ, the pulp organ of the permanent teeth, it takes longer time for the formation. It functions for a longer period, and the pulp aging in this case is slower. Now, one of the important questions they ask in the exam for a 3-mark short note is the functions of pulp. So you need to remember these functions. One is the inductive, formative, nutritive, protective, defensive, and repair. So in this, you need to remember the headings first, okay? And you need to just substantiate few things about these functions. So what do you mean by inductive function? The dental papilla, it determines the crown pattern, and the differentiation of amoeblasts is through its inductive influence. So we have the inner enamel epithelium is going to have an organizing influence on the ectomesenchymal cells of the dental papilla, thereby that inductive function is maintained. Formative is basically in the pulp, you have the pulpal odontoblasts, which are the formative cells of the dentine, and they're involved in the support, maintenance, and continued formation of dentine. The nutritive function, the word nourishes, the pulp nourishes the dentine through the odontoblast and their processes, and by means of the blood vascular system of the pulp. That is, it provides nutrition and oxygen to the odontoblast. So the lifeline of the tooth is basically the pulp, because the pulp has a large blood vascular system. Protective function, it produces, you have the reparative dentine formation, dental sclerosis, and it acts as a way in the sense that it prevents the irritating stimulus from reaching the pulp. The defensive function is because of the defense cells. You have macrophages, you have lymphocytes, you have neutrophils, you have eosinophils, you have mast cells, you have plasma cells, which aid in defense and repair of the pulp. We shall discuss about these cells a little later. Again, the reparative function is again because of if there's a rotation, you have reparative dendrin formation and thereby calcification of tubules. Now, another question which is asked as a short essay question for a 5 mark is the histology of pulp, or can they ask you the histology, or they can ask you the zones of the pulp. So in this case, you need to write about the different zones. So the central region of both the coronal and the radicular pulp, it contains large nerve trunks and blood vessels. And periphery, the pulp is circumscribed by the specialized odontogenic region, and it's composed of the following zones. The first one is the odontoblastic zone. The second one is the cell-free zone. The third one is the cell-rich zone, and the fourth one is the pulp core. So we go into the different zones: the odontoblastic zone, the cell-free zone, the cell-rich zone, and the pulp core. So let us discuss about each of these zones first. So as the name suggests, it's called as odontoblastic zone. It's found along the periphery, and they are basically the dentin forming cells. The other zone is called as the cell-free zone. It's otherwise called as a zone of Wheel. So in the exam, the question might be just zone of Wheel. So you just need to remember that's the other name for the cell-free zone. It's found below the odontoblastic zone. This is a space in which the odontoblasts, they move pulpward during tooth development. Another thing you need to remember is that the presence of a network of fibers, they've lost their myelin sheath, and these are known as plexus of Rashkov. Okay, so when they ask you about cell-free zone, you need to mention about the subodontoblastic plexus or the plexus of Rashkov. Next is the cell-rich zone. It's found adjacent to the pulp core. It is rich in cells like fibroblasts and undifferentiated mesenchymal cells. So here you can see the different zones: the cell-free zone, odontoblastic zone, the cell-free zone, the cell-rich zone, and the pulp core. Now, what are the contents? So in the histology, you need to write about the zones, and you need to also write about to mention the contents, which basically includes the cells, the matrix, the vasculature, the lymphatics, the nerves. So if you look at one of these, we'll just start with the first one, which is the cells. You have the odontoblast, you have the fibroblast, we have the undifferentiated mesenchymal cells, and you have the defense cells. So now we shall discuss a few points about these cells. Next, of course, also along with that, you have the fibers and the ground substance, the vasculature, lymphatics, and the nerves. Now, when you discuss about the odontoblasts, the first thing you need to remember is that they are found in the periphery of the pulp. They are adjacent to the predentine. The cell body is in the pulp. The process is in the dentinal tubule, and the length is around 25 to 40 micrometer, and the diameter is around 6 to 7 micrometer. So basically, odontoblasts are dentin forming cells. So tall columnar, basically cuboidal, ovoid, large oval nucleus. It fills the basal part of the cell and actively synthesizing, odontoblasts. You see the rough endoplasmic reticulum, Golgi apparatus, mitochondria, and vesicles. So basically, we divide the odontoblast into 3. You have the active odontoblast, you have the intermediate odontoblast, and you have the resting odontoblast. So the active one is the synthetic one. The intermediate one is the one which has less organelles, or less organelles are less. Whereas the resting odontoblast is the one which is little stubby. It has the cytoplasm is less of organelles, and the nucleus is dark and close-faced. So just 3 types mainly: active, intermediate, and resting. Now, fibroblast, the most numerous cell type which is present in the pulp. So if they ask you which is the cell that is present maximum in the pulp, it is the fibroblast. And the function of the fibroblast is to produce collagen. It has dual function. It produces collagen. It also degrades collagen. And they're basically stellate shape. They possess processes that show intercellular junctions. And you have abundant rough endoplasmic reticulum, mitochondria, and all the other organelles that are in the cytoplasm. In the younger pulp, you have more intercellular organelles. They are actively in protein synthesis. Older cell pulp, the spindle shape, they have short processes. They're fewer, and the number decreases. And as we mentioned earlier, they have dual function. They have function of synthesis as well as degradation. So fibroblast, one question which they asked, the cell that is maximum seen in the pulp is the fibroblast. Then the other cells are the undifferentiated mesenchymal cells, which are found in the cell-rich zone. They're polyhedral in shape. They have a large oval nucleus with peripheral process, mostly seen in young pulp, and the number decreases with age. Now, the thing about the undifferentiated mesenchymal cells is they're totipotent cells, and they have, as the need arises, they can differentiate into odontoblasts, fibroblasts, or macrophages as per the need. Now, about the defense cells, we have the histiocytes, macrophages, the mast cells, the plasma cells, the neutrophils, basophils, eosinophils, and the monocytes. So we just discussed a few things about these cells. So macrophages are basically regular shaped cells. They're having short blunt processes. They have a dark staining nuclei. They contain mitochondria, rough endoplasmic reticulum, free ribosomes, and their basic function is engulfing, that is phagocytosis. The second one is the plasma cell. It is seen during the inflammation of the pulp. Basically, they are chronic inflammatory cells, and of course, production of antibodies. Mast cells are seen again in the inflammation of the pulp. They have a round nucleus. They have a dark staining granules that are present in the cytoplasm, and they are seen along the blood vessels in the inflamed pulp. When you come into the metrics, you have two types, basically the ground substance, which is basically consists of the acid mucopolysaccharide and the protein polysaccharide. So what is the basic thing of these metrics? It lends support to the cells of the pulp. They serve as means of transport of nutrients from the blood vessels to the cells, and as well as for the transport of metabolites from the cells to the vessels. Look at the fibers. We have basically the collagen fibers, predominantly collagen type 1 and type 3. The number increases with age, and they are termed diffuse or bundled collagen depending on their appearance. The next thing, as we have discussed earlier, the blood vessels, the pulp organ is extensively vascularized, and it's supplied by the superior and inferior alveolar arteries. This picture you can see the rich vascular supply of the pulp. So the blood vessels, they enter the pulp through the apical foramen, what's called as accessory foramen. The arterioles give of numerous lateral branches that enter the subodontoblastic layer, where a capital bed is seen. And you have a nutrient canal, which houses the interdental and interradicular arteries, veins, lymph vessels, and they are called as the perforating canals of Zerkandel and Hirschfeld. Come to the venous system. The venous system is seen in the pulp. It carries the blood away from the pulp, and the vessels exit through the apical foramen or the accessory foramen. So here again, through the apical foramen, you can see the blood vessels. The lymphatics, the thin-walled, they're having an irregular lumen, which is composed of endothelial cells that are surrounded by an incomplete layer of smooth muscle cells. The lymph vessels that drain the anterior teeth, they pass to the submental lymph nodes. Those of the posterior teeth will pass to the submandibular or the deep cervical lymph nodes. Nerves, the majority of the nerves that enter the pulp are non-myelinated. Many of these gain a myelin sheath later in life. And the non-myelinated nerves are found in close association with the blood vessels of the pulp, and many are sympathetic in nature. Now, the nerve axons or the nerve endings from the parietal zone, they pass to the cell-rich and cell-free zones, and they either terminate among or pass between the odontoblast to terminate adjacent to the odontoblastic processes at the pulp predentine border or in the dental tubules. Many of these indent the odontoblast surface and exhibit a special relationship to these cells. Most of the nerve endings located among the odontoblasts are believed to be sensory receptors. So you can see the nerves and the vessels, the pulp. Again, you can see the cross-section nerves. Now, the next topic, which is important, is the age changes that are seen in the pulp. Again, has been asked as a short note question. So what we need to remember is you need to remember the headings first. You need to remember about the decrease in the size, the reduction in the vascularity, the cells decreasing with age, loss and degeneration of the myelinated and unmyelinated axons, then the repair capacity being reduced, and then of course the pulpal calcifications. So each of these things now size, because there's continuous secondary deposition, there's going to be a slow decrease in size. Vascularity again is going to reduce as the age proceeds. The number of cells also will start to reduce as the age proceeds. Again, there is a reduction in the sensitivity because there is a loss and degeneration of the unmyelinated and myelinated axons. And as such, the repair capacity is also reduced with age. Another feature that happens is your fibrosis, where the aging pulp, which is accumulation of both diffuse fibular components as well as the bundles of collagen fiber. And any external trauma or deep caries in these things causes localized fibrosis or scarring effect. The important question they ask again is a short note, is your pulp stones or denticles. So either the question is going to be asked as a denticles, or they're going to ask you as pulp stones. Or when they ask you as the age changes of pulp, you need to write all the points. Along with that, you need to write also about the pulp stones or denticles. So now let us see what are pulp stones. So pulp stones are nodular calcified masses that appear in the coronal or root portions of the pulp organ. And they're basically classified as true, false, diffuse. And according to the location, they're classified as free, attached, and embedded. So we have true, false, diffuse, and then you have free, attached, and embedded. So the pulp stones, they appear close to the blood vessels and nerve trunks. And histology sections show more frequently the pulp stones than the radiographs, as majority of the stones are relatively smaller. So you have true pulp stones and you have false pulp stones. So they appear as they appear as concentric layers of calcified tissue. These calcification appear within a bundle of collagen fibers or location free of collagen. And the calcification of thrombi in these blood vessels, you have fibroblasts may be seen. The diffuse calcifications, mainly you have irregular calcified deposits in the pulp tissue. The orientation, which is parallel to the nerves and muscles, and usually seen in the root canal. The free denticles, so you have free, attached, and embedded. The free denticles are entirely surrounded by the pulpit tissue, and all the pulp stones begin as free pulp stones. And the attached pulp stones, they are partly fused to dentine, and the embedded pulp stones are entirely surrounded by dentine. So here again, you can see the pulp stones, the importance of pulp stones during root canal treatments, the strategic location of the pulp stone. Now, what are the clinical considerations that we need to remember is about pulpitis, which we'll be studying a little later when you come to your third year. Discuss about different types of pulpitis, the inflammation of the pulp, and the progression of the caries process from the pulp to the periapical area, and so forth. So, and then you have different tests which we use to check for the vitality, mainly heat, cold test, and picometers. Now I should just summarize what I've taken. In the what you need to know, what is a pulp? It's always asked as a viva question. So the pulp is connective tissue, soft connective tissue. You need to explain what it is, where it is located, the types, and we discuss about the different functions of the pulp. First, you need to study the headings, and then you need to write about a few points about each one of them. Then we discuss about the zones and the histology, mainly the different zones one by one. Plus, you need to draw the diagram for each of them, and then the age changes. Okay, and in the age changes, we must remember to write about even the denticles and the pulp stones, along with all the other important points. With this, I end my presentation. I would like to thank the organizing committee, Dr. Sunil sir, for giving me an opportunity to share my inputs on this topic. Thank you, everyone.